Hello everyone, my name is Ngọc Ánh Mai and today I will presentations my professional health placement experience. I'm complete my placement with the Public Health Associations of Australia in Oriole Health, a special interest group with my supervisor was Tân Nguyen. And in this presentation, I will talk about organization, my role, tasks, and skill I developed and what I learned from this experience. So first of all, I will start about PSAA. So PSAA is a Public Health Association of Australia. It is a big of a organization for public health in Australia. And PSAA is a national non-profit organization with its work to improve population's health through prevention research and policy. The oral health special interest group focus on improving oral health, reducing health inequality. Many Australians have oral health problem because one of them because low income, high treatment costs, and limits access to dental care, especially in the rural area. And PSAA was work with government, university, and public health expect to support fair and preventive healthcare for all Australians. For my placement focus, my main projects were updating the PSAA Oral Health Position Statement. So the goal for my placement were improve my research and policy writing skill, update national oral health data, apply evidence-based practical, and also work professionally in the remote public health environment. These projects will help me understand how health policy is developed and how evidence can support the avocados and trends. For a key placement task, during my placement, I was complete self tasks like I review PSAA policy document and framework. I'm update oral health data from AIXW and the burn of disease study. I search and literally and check evidence. I edit the policy using track and trend in Word. And I also communicate regularly with my supervisor through email or meeting every week. Those tasks have me learn how to collect a strong evidence and write a clearly for policy audience. Uh, about my skill develop, this placement will have me develop so many important skill. One of them is I can improve my evidence-based policy writings by learning how to translate the research into the clear recommendation. I also gain data interpretations skill by reviewing national health statistics and understanding a burn of disease report. I also improve my professional communication, such as like I was asking for question, response to the feedback, and report to my project in a professional way. And finally, I learned a strong time management, a task management skill because I work independently and remotely for in this replacement. Uh, about the impact and reflections, this experience had a positive impact on my learning and confidently. I became more confidently in the policy writing, actually, and I also understanding the role of a role of advocacy in the public health. I was improve my research to policy skill by by working with the real national data and policy document. My contribution to PSAAs were updating a key of the oral health policy with a current data and clear language to support advocacy. So overall, this placement will help me understand how public health organizations influence policy and support the equity in Australia. In conclusion, this placement was available and meaningful experience for me. I gained a real public health policy experience, developed research and communication skill, and build a confidence in a work in a professional government. Displacement illustrators my passions for public health, especially policy and preventions. Okay, thank you for your listening my presentation today.